Hello friends, I am Dr. Bharat Bhushan. I welcome you all on the YouTube channel SOMAS Evolution Classes, a best environment to nourish the need of education. In this video, I will be touching the most important and high demanding need of the hour. Let us start with, if you are using this on the similar way of working in any part of the day, you might be sitting on the comfortable seat, sofa, or having lunch or dinner, mostly the junk food, while watching the TV or video every day. While watching the TV, you may sleep or may have nap on the sofa just after eating some heavy lunch. You might be using the laptop or at the office or at the home in a awkward posture, which seems to be more comfortable after the day long tedious job. On sitting like this to complete the job either at your workplace or at home or while doing the work from home. You might be using the cell phone or the mobile more frequently and don't want to miss any message or comment on the social media. Might be using the mobile phone in this way, or might be sitting in some comfortable position and using the mobile phone. While doing some task, might have lifted the weight object like this. While being on the workplace, using the phone while doing the work on the system at the same time simultaneously while holding the landline with the head and shoulder. While traveling, sitting in a awkward manner or discomfortable position and may or may not be using the phone simultaneously. While driving the car and holding the phone with the help of the shoulder. If you are doing the work in the same or the similar position as I had shown you a few of them, then you might suffer from one or the more health issues in the near future, as you might have passed through the corona time and remained at home for the months, and multiple diseases might have suffered, and we might not be doing the ideals properly at a time. So we must see this slideshow till the end. The posture is defined as the position relatively to perform a specific task or an activity. It may be alignment of the body, we can say it is relative arrangement of the body, or we can say the position and the movement of the body throughout the day or life. According to the American Academy of Orthopedic Surgeons, as cited by Kendall et al. In 2005, the posture is the position someone holds their body in which they are standing or sitting. The posture can be understood in a simple way. P. Pelvis in a neutral and the weight distributed. O. On the whole foot. S. Stable joint. T. Tight abdominals. U. Upright ribs. R. Retracted shoulders. E. Ears over the shoulder. This posture can be classified as active posture, inactive posture. Active can be divided into two, static and the dynamic. Static means when we are at rest, dynamic when we are moving. The posture is given more importance as we have taken bipedal stance from the quadrupedal stance, and due to that, the few muscles have to work more than the other muscles, and the bipedal stance, the posture becomes the necessary topic for the study for the physiotherapy students and cannot be neglected at any instance. Ideal good posture is a one in which we can minimize the effort, conserve energy, guard against the formation of the deformity. It also helps us to maintain the body shape and also protect from the injury or the deformity. Continuing with the good posture, it reduces the muscle overload and prevent the unnecessary strain, fatigue, decrease the incidence of musculoskeletal disease, improves circulatory and respiratory efficiency, and also improves the mental and the psychological state. Now, talking about the bad posture, as this is the reverse of the good posture. It is any habitual self-imposed position that can cause stress, unnatural position, or lead to some efforts for the joints, muscles, and bones, etc. Effect of bad posture includes low energy level, chronic pain in the area where we are maintaining the bad posture, and lack of oxygen, heat problems, lack of confidence, digestion issues, secondary deformities, compensatory postural defects, and fatigability, low energy frequency, bad cosmetic appearance, and psychological disturbances. Let us talk about the factors affecting the posture. It includes the general health, body build, gender, strength, endurance, kinesthetic awareness, personal habits, demand on the workplace, social traditions, and reluctant to exercise, injury, trauma, poor movement techniques. Posture is the single most cause of painful soft tissue syndrome affecting the body. Continuing with the factors, there may be the environmental factors like phone, backpacks, vision, high heel shoes, occupational, recreational, prolonged activity at the workplace, unique demands on the body, physiological, personal reasons either because of pregnancy, nutritional, maybe because of deficiency disease, pathological disease like ankylosing spondylitis. Due to changes, there is evolution of standing computer desks. In this view, you can see the variation of standing posture that includes sway back, lumbar lordosis, kyphotic forward head. Last pic shows the good posture in standing. For study of the posture, we consider three major triangles in the body, that may be one for the head, second for the shoulder, third for the pectoral girdle. Now let us study the faulty or the bad posture, their analysis and the treatment. There may be lordotic posture, there may be kyphotic posture, scoliotic posture, sway back posture, flat back posture, flat neck posture, forward head posture. Now talking about the lordosis. It is a normal curve in the cervical and the lumbar region which is found abnormal when it is exaggerated or maybe because of some pathology. It occurs because of weakness of the abdominals, contracture of the hip flexors, some congenital issues, pregnancy, high heel shoes, spondylolisthesis and tightness of the cervical extensors. Treatment includes the lumbar spine anterior stretching, strengthening of the abdominals, glutei, hamstring muscles, toe touching in the low setting, forward exercises, spinal and hyperextension should be avoided. Now the kyphotic posture or the rounded back. As the name indicates, it's in the thoracic region and when the flexion is anteriorly and the lumbar spine is hyperextended. Causes includes the shortening of or the tightness of extensor of the cervical spine and the lumbar spine, flexor of the hip joints, weakness of the neck flexors, upper back extensors, hamstring, ankylosing spondylitis and may be due to congenital anomaly. Now the treatment of kyphosis include the relaxation, repeatedly stretching, session, maintaining the good posture of head, neck, shoulder and mobilization of the whole spine, controlled pelvis and the restive exercises. Now next is scoliosis, the lateral curvature of the spine. When it extends more than 10 degrees from the normal and it's on the one side which is facing more concavity. Structural may be because of the disease, osteopathic disorders or idiopathic disorder, and non-structural includes the leg length discrepancy, muscle spasm of the neck, back, habitual and the asymmetric posture also contributes to it. Treatment of scoliosis include the active correction with the postural adaptation, passive correction by hanging, relaxing techniques, deep breathing, balancing, exercise and traction. Sway back posture. As the name indicates, the sway means moving away of the back and there are lot of postural adjustment because of the cervical and the lumbar region. Common causes of sway back is tightness of hamstring and abdominal muscles, weakness of the one joint iliopsoas or the bony abnormality. The treatment includes the stretching of the hamstring, abdominal muscles, relaxation of the body, strengthening of the iliopsoas, maintain position of the head, that may be backward extension of the thoracic spine. Now the flat back posture. As the name indicates, back becomes flat as you see in the picture. Causes include the tight trunk flexors, tight hip flexors and the weak lumbar extensors, probably the hip flexor muscles. Treatment includes the stretching of the trunk flexors, hip extensors and maintenance of the arch by actively holding the passive support to maintain the lordosis. Flat neck posture shows the increase in the upper flexion of the occiput as seen in the figure. Causes include the anterior short muscles using high pillow or due to the occupation like as in the soldiers. Treatment includes the relaxed passive movements, manipulation, mobilization of the cervical spine, isometric and strengthening exercises of the neck muscles, especially the sternocleidomastoid and the scalenus muscles. Forward head posture. This is excessively the upper cervical spine and the flexion of the TMJ dysfunction may be included with the retusion of the mandible. Causes include the walking on the high pillow, tight levator scapulae, stretching, and weakening of the anterior neck muscles. Treatment includes the stretching of the levator scapulae, sternocleidomastoid, screenii, and the occiput muscles. Avoid high pillow, PNF technique, and the isomatics are the good treatment. The figure shows how to use the phone while holding the hand while standing. Now this figure shows how to use the phone while standing on the sofa or the comfortable seat. This figure shows how to lift the weight from the ground. This figure shows how to walk and how to run. This figure shows how to sit on the computer while working. Now this figure shows how the forward bending hurts the complete body. There are lot of tests like LS test, Thomas test, SLR, and other tests for ROM, strength testing, and to measure the assessment of posture that can be done by some therapist. If you have some issues related to the posture, you may contact with the details shared. If you enjoyed this video, please do like and subscribe to our channel Somas Evolution Classes, and for more interesting videos, stay tuned with our channel. Thank you.